ultrasound guided right IJ triple lumen central venous catheter insertion. This is my patient. She's an 86-year-old female. She has no allergies. She needs a central line today for her cabbage, so this will allow for precise hemodynamic monitoring, vasoactive infusions, large transfusions, PA catheter placements, a variety of things that will help her in her surgical recovery and process. So no contraindication. She's cooperative. She doesn't have any infection at the site or abnormal pathology or anatomy that would hinder us placing this line today. She has no abnormal coagulopathy. Her INR is 1 and her platelets are 240, so she's good to go there. I have explained the procedure to her, the risk, the benefits, the alternatives, and she written consent has been obtained. I know it looks like she's draped, but she's not. It's really hard to put this drape back, so we're going to pretend like she's not draped right now. I just did some hand hygiene. I'm going to connect her to our EKG and our pulse ox with audible alarms on. She's in sinus rhythm. Her SpO2 is 98%. Vitals look good. She is in 10 to 15 degree Trendelenburg. Her head's turned to the left, and she has a shoulder roll in place just to give us that extra access to the site. So I have taken my non-sterile probe. I've identified my sternocleidomastoid muscle heads. The bottom of the clavicle here is the bottom of our triangle base, and the internal jugular vein is within this triangle. So it's lateral to the carotid artery, and on the transverse view of my ultrasound, I can identify the internal jugular vein. It's compressible. It's non-pulsatile, so I know that that's the vein. And then right next to it, anterolaterally, is the carotid artery. It is non-compressible and it is pulsatile, so I know that that's the artery. So I'm going to, once I've identified that, I have my spot, I'm going to now put on my mask and my eye cover and my hair cover. And I'm going to now, I'm going to just open this up for myself a little bit later, just sterilely, making sure not to touch anything on the inside. I'm going to have that open for myself. I'm going to then take my chlorhexidine, I'm going to scrub, and I'm going to allow for a 3-minute dry time. So I'm going to make sure to go concentrically and then allow that to dry, toss that in the trash. I'm going to then don my sterile gown and gloves. Obviously they're not sterile right now and they're not even in the packaging, but in real life, I put my gown on, I would not touch anything else. This would be a sterile thing and somebody else would tie me up. But obviously, right now, I'm working with what I have. So this would also be sterile glove donning, but working with what I have right now. So sterile gown and gloves. I've got my kit already opened. My assistant is now, I'm opening up my sterile probe cover that they dropped for me. I'm gonna hold it right here. My assistant's gonna put my ultrasound in the sterile probe cover with some sterile jelly. So now my ultrasound is sterile. So I'm checking out my kit over here. I see that it has my binder needle, my dilator, my blade, my needle drivers, some cleaning products I could use, my local, everything looks good in here. My guide wire looks good, it looks like it's through. So now I can get started. So sure, we did a timeout already. I'm going to flush and cap all my lumens except for my distal port. I am now grabbing my ultrasound probe, and I'm going to reconfirm my IJ. I'm going to get this, drop some 1% lidocaine, put my 25 gauge needle on it, and I'm going to localize my area really good. So after I've done that, I can now do my needle insertion. So I'm going to go at an ipsilateral angle to the nipple. I'm going to maintain negative aspiration, and I've got venous blood return. It's dark, it's non-pulsatile, so I know that that's the IJ. So So now I can take this off, and I'm gonna do like this, and I'm going to now advance my guide wire. So at this point, I'm going right here, and I'm going to advance it about 15 to 10 centimeters, and I'm looking for ectopy on my monitor. So once I get about 10 to 15 centimeters, I see my 20 mark. So now I'm going to come out just like that. And what I would like to do is I would like to confirm it with my ultrasound. I'd like to visualize that wire. I'm confirming on the long axis of the ultrasound. I'd like to save the image there. My guide wire is in place and I can see it. I'm keeping my hand on the wire. And my next step is I'm going to make a small, keeping my hand on the wire the whole time. I'm going to make a small cut with my blade for the dilator. So I'm going to go right along the edge, make a small cut here, and then I'm going to get my dilator. I'm going to thread it on my guide wire, all while keeping my guide wire in place and not letting it move from where it's at, because I don't want it to go any further in, I don't want it to go any further out. I'm going to go down about 2 to 3 centimeters and just then remove it. Just make sure that looks good. Now take that off. Now I'm going to advance my catheter. So my ports have been flushed and they're ready for me to go. They're capped. And now I'm going to, all while still keeping my hand on the guide wire, I'm going to advance this. I'm going to do the push and pull method. So I'm going to push the catheter in while pulling my guide wire out. Obviously I'm not going to let it hit anything right here. Kind of working in tech quarters, but I'm going to push my catheter in all while keeping my guide wires sterile and not letting it hit anything. So I would make sure to maintain this. It wouldn't actually touch any of this. And then after, I'm keeping my guide wire sterile here, and then I'm going to aspirate and flush all my ports and confirm my patency. I'm going to take this, flush, aspirate, and I confirm patency, and now I'm going to suture and secure. So I'm going to get my needle driver, I'm going to get my needle. This suture has been used multiple times by myself to practice, so it's knotted up and kind of, but I'm going to hold it like this, go through the loop right here, get some skin, and then I'm going to pick it up. And now I'm going to take this, I'm going to loop it 3 times, 1, 2, 3, and pull it through. Loop it twice, pull it through, loop it once, pull it through. I'm going to do that on both sides to secure it. Once I've done that on both sides, I'm going to put my bio patch on, and I'm going to put my dressing on. Once my dressing and my bio patch are in place, I am done. No complications. My vitals look good. My patient is good to go. So now I'm going to order a chest x-ray, dispose of all my sharps, document my indication, my procedure, my consent, my prep, my attempts, any complication,